My name is Dr. Amy Adair. I am a member of the Northern Virginia Dental Society and a VDA delegate. Our HOD meeting is coming up in January 2026, and there are some important resolutions that I am going to discuss. The first resolution is number 301, Policy on Dental Practice Ownership and Transparent Reporting of Ownership. Delta Dental of Wisconsin recently acquired a corporate dental chain comprised of 25 plus dental practices in the state of Wisconsin and in some bordering states. The Northern Virginia Dental Society formed a work group to research into the possibility of something like this occurring in Virginia. And we concluded that there are several legislative loopholes that would allow non-dentists, including insurance carriers, to own or control dental practices in Virginia. Supporting this resolution allows the VDA to support changes in Virginia legislation to close these known loopholes and prevent this from happening in Virginia. It also supports transparency and ownership so that patients know who owns and controls the dental practice. Please consider voting yes to Resolution 301. This next resolution may come as a shock. A couple of years ago, we celebrated enactment of the DDH Compact in hopes that it will encourage more hygienists to come to Virginia. But note that this compact is for both dentists and hygienists. Unfortunately, it seems that the direction for the rules regarding clinical assessment requirements will be well below Virginia standards. And in a deeper dive, this is my conclusion. We don't need a VDH compact for military members and spouses. We have a strong expedited licensure pathway already in place. The DDH compact is favorable for DSO supported traveling dentists and hygienists. The continuing education and licensing standards are below current Virginia licensing requirements. There is no requirement for a psychomotor examination or years in practice for a dentist to obtain privileges and work through the DDH compact. What does this mean? Under the DDH compact, a dentist licensed in another state that has no requirement to demonstrate adequate hand skills can immediately practice in Virginia under compact privileges. That's like going on a plane with a licensed pilot who never demonstrated how to actually fly a plane. We need to protect the public and get out of this now before it becomes implemented. Please consider voting yes to Resolution 302. So what about Resolution 101S? Why would I recommend a no vote? Bottom line, this lowers the standard for obtaining a dental license by credentials in Virginia. As I mentioned earlier, since we cannot control another state's criteria for licensure pathways, we need to make sure that a dentist has enough practice experience if they want to apply for a license by credentials in Virginia. The current regulation of practicing 5 out of 6 continuous years is standard and consistent with most other states. This protects Virginians. Relaxing back the number of years of practice lowers the standard for licensure by credentials. It can make it easier for dentists to obtain a dental license in Virginia, but unfortunately, it will not solve the allocation problem of getting dentists to practice in rural areas of Virginia. Based on the 2024 workforce report, what we know is that Virginia has a higher than average dentist to patient ratio with positive trends since 2013. Dentists want to come to Virginia and practice, and the current licensure pathways are more than adequate to allow this to happen. We don't have a number of dentists problem in Virginia, so we can maintain our standards where they're at. We do have an allocation problem, as most states do. However, historically, increasing the number of dentists by changing or amending licensure pathways is not going to solve the allocation problem. This leads to the question of why is there a push to increase the number of dentists in Virginia? And honestly, I don't know. So please consider vote yes to Resolution 301, vote yes to Resolution 302, and vote no to Resolution 101S. Thank you for your time.